live now.
Good evening. My name is Kirsten Sickley, and I have the privilege of serving as the Chief Executive Officer of YWCA Central Carolinas. I want to welcome all of you in the audience to our forum this evening, Black Birthing Matters, a conversation on Black maternal health and reproductive justice. I'm so glad that you've carved out the time to be with us this evening to discuss this important topic with our amazing panel. I want to give a special thanks to our amazing partner, Upstream, for sponsoring this events forum and sponsoring it in memory of our friend, Dr. Ophelia Garman-Brown, a wonderful advocate, longtime YWCA supporter, and a friend to so many that we all felt she was one of our best friends. Thank you to all of her colleagues, her friends, and her family who are also in attendance virtually. I'd like to also thank, in absentia, our staff member and wonderful colleague, Jamila Green, our community engagement manager, who worked with these panelists to plan this entire forum and developed the questions. Due to an emergency, Jamila was not able to moderate tonight as planned, and we are missing her, but we are very grateful to have Lugenia Grider, affectionately known as Genia, who is an educator and advocate for maternal and infant health, stepping in within 48 hours notice and doing us proud. Thank you so much, Genia. I'm going to pass it over to you to introduce the speakers.
Good evening, everyone. I'm so excited to be here, and it is a pleasure to be the moderator for this event. Again, I am Lugenia Grider. Everyone knows me as Genia. I would like to introduce our dynamic panelists. Jamila did such a wonderful job identifying these amazing women in maternal child health. The first person I would like to introduce you to is Shavette Campbell. Shavette serves as a project manager for the Center of Disease Control Foundation, working as a liaison between the CDC Foundation and North Carolina DHHS Communicable Disease Branch to best serve and support the North Carolina State and public health programming, disease, and outbreak responses. The Philly native is certified health educator specialist and a doula. Welcome, Shavette. I'm glad to have you. Our next panelist is Maya Hart. Maya is the North Carolina coordinator for reproductive justice organization, SisterSong. This mama is a community advocate and organizer, certified doula, serves on the board of Carolina Abortion Fund. Welcome, Maya. And a good friend and colleague, I'll introduce to you guys Tomeka Isaac. Tomeka is the executive director and founder of Jace's Journey, a nonprofit organization she co-founded in 2019 with her husband, Brandon. The organization's mission is to work towards eliminating disparities in maternal and infant health through education, advocacy, and community engagement. If she can save at least one life on her quest for change, then she has kept her promise to all the mothers and children out there and to the one that made this all possible, Jace Alexander Isaac. Thank you, Tomeka, for joining us tonight. Awesome. Well, we're going to jump right in. My first question to you guys is, as an educator and advocate, how does this topic relate to the work that you are doing? And I'll go ahead and let Shavette answer that, and then we'll go right to Maya, and then Tomeka, you would be last.
Thank you so much, Genia. Yes, so currently, actually previously I'd like to talk. I worked with March of Dimes. I was a program coordinator, and I worked with health education in my community. And, you know, I truly love the work of just being able to talk with women, with men, with non-gender conforming people about their reproductive health, you know, talking about creating a reproductive plan. A lot of people don't think about that because they think, oh, I'm too young for that, or baby fever, keep it away from me. So kind of having those conversations were really important. And I felt like that this is really important as well, because working at March of Dimes, we know the statistics, we know the facts. And so we are going in the community and helping others realize that and what they can do to advocate for themselves. Currently, as a project manager, I'm working with a jail health. So looking at prisons and confinement facilities, and that is a major place that needs, to be acknowledged when it comes to women who are pregnant, how they're able to have their babies, and things like that. I also work with a nonprofit, international nonprofit called Empowering Brazilian Youth. And we have a foundation of women who are still suffering with, issues regarding maternal child health internationally, even thinking about a couple of years back when Zika was very, very prevalent. So this is something that truly relates and I'm very passionate about.
Thank you. Thanks, y'all, for having me tonight. I am Maya. I use any pronouns, and I'm the North Carolina coordinator with SisterSong Women of Color Reproductive Justice Collective. And on a personal note, I am a new mom. I have a 16-month-old, and I am also a full spectrum doula and shifting more towards postpartum support and lactation support, really because of my own personal journey into motherhood and recognizing the lack of support specifically for moms and families and parents beyond birth. So that's sort of my personal stake in this conversation. And then with my work at SisterSong, as a reproductive justice organization, as Shavette mentioned, knowing the racial disparities and how Black birthing people and people of color broadly are disproportionately impacted in the healthcare system, we really work to center and really highlight the narratives of historically oppressed and marginalized communities. So that primarily looks at Black birthing people, but as well as queer and trans folks. We like to be inclusive and make sure we're really considering who has the least amount of access to the resources that we are talking about tonight. So my work a lot is pushing the conversation to really focus on access, because we know that even when these healthcare resources exist, they're not necessarily accessible and affordable to the folks that we are working with. Thanks for having me here tonight.
And hi, it's me. I'm sorry about my voice, I'm recovering. So I started Jace's journey based off an experience where when I came out of it, I felt like my birth didn't matter. Of course it mattered to me, but it didn't matter to the people who were supposed to make sure me and my son made it out alive. We started Jace's journey basically because I felt like I had no idea about the Black maternal health crisis at all. And I didn't want other people to be in the dark as well. I didn't realize that there were disparities. I myself went to all my appointments, I lived in Charlotte, so we have a number of places to go. And I just wanted to continue having the conversation. And the more and more I got into it, it just kind of developed into where can I help, period. And through our organization, we've provided doula services through postpartum. And I've always asked, the doulas that we use to make sure it's an extended postpartum, because I don't think people have an idea of how hard it is postpartum to actually, recover. And I felt like there's been a lack of support across the board, and people don't really understand how much support they need. I didn't know I needed a doula when I was pregnant. I thought that my doctors were going to do what they were supposed to do, but they didn't. And now coming out of this, I have mad love for doulas, even though I didn't even know what a doula was really whenever I got pregnant. And just to have those conversations and let people know, hey, anything can happen, but there are resources, there are people out there supporting this work and making sure that you're educated enough to know what you're doing, because I felt like I wasn't. And that, through my own fault too, but just to talk about it, to share our story and what we experienced, to hopefully save somebody else from going through the same thing.
Well, thank you guys. And as a doula, myself, I've been a doula now for over 20 years. And, you know, we kind of close the gap and fill the space of where everyone is meeting here. And so I feel like I'm a moderator and I'm kind of doulaing the birth advocates in this space. And so I'm excited. You know, I often think, and people often separate conversations about Black maternal health and reproductive justice. And so I want to bring reproductive justice into the conversation because, you know, when we use the words full spectrum, we mean full spectrum. We mean we're covering reproductive justice and not just pregnancy or not just childbirth. So I want to present and ask the question, Maya and then Shavette, what is the difference between reproductive justice and reproductive rights movement? Like, what are the distinguishing items or information that you can give our audience this evening?
Sure, absolutely. So at SisterSong, we define reproductive justice as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. So it's a really broad framework, because if you think about everything that impacts, you know, the safety and well-being of our communities, especially when we're thinking about working class folks, people of color, Black folks broadly, really any issue you care about, whether it be police violence or voting rights, all of those impact our abilities to raise children and families safe and sustainable communities. So it's an extremely broad framework. And then there's also 4 principles to reproductive justice that I'll read out briefly. Every individual has the human right to 1, decide if and when they will have a child and the conditions under which they will give birth. 2, the human right to decide if they will not have a child and their options for preventing or ending a pregnancy. 3, the human right to parent the child they already have with the necessary social supports in safe environments and healthy communities and without fear of violence from individuals or the state. And then finally, every individual has the human right to bodily autonomy, free from all forms of reproductive oppression. And so I think when we're talking about reproductive rights, to me, I think more of the legal aspect. So I think of, as an example, the ACLU would be an organization that comes to mind that does reproductive rights advocacy, legal work, which is absolutely necessary and vital work, but it needs to be done with the understanding and from the reproductive justice framework that looks at historically who has benefited and who has not when we're looking at accessibility around Black maternal health and the healthcare setting more broadly.
Yes, I definitely think Maya completely encompassed that. I love that. But yeah, just going towards what she's saying is that looking at reproductive rights is looking at the legal aspect of things. And I think what this conversation makes me think about is how we always, like as children in elementary school, we would always talk about equality and how equality was the topic. We do the same thing in January around the 17th, and we go and we say equality, equality. And then now things have started to shift in people's minds where they understand that equality doesn't, just because everybody gets the same, doesn't mean that's what they need. That doesn't mean that's what is going to fulfill the gaps or anything like that. We're just putting a broad spectrum stamp on everything. And I feel like we've moved from equality to equity, where we're seeing that scope of, you know, everybody's starting to get exactly what they need. It may not be the same as the next person, but that's really fulfilling that. And then you see the justice part, which is really going above and beyond, not only giving people what they need and what they require, but really deep diving into access. You know, equality is just not, it's the minimum, it's the bare minimum. And so what I feel like reproductive justice, you know, allows people to do is to really see the aspect of the individual and the human as who they are and what they require. And like Maya said, the autonomy over themselves. So it's really kind of just looking at those inequities, trying to tackle them, going through. And I feel like that's what the reproductive justice movement has done. And I'm really, you know, just proud to be a part of it, because we need that. Just looking at the fact that we don't have standardized, sex education, family planning, any of those things. We're having this conversation right now because we're trying to reach that level of justice. And so, yeah, I'm going to leave it right there.
Excellent. Thank you. Maya and Shavette, you talked about reproductive justice and what it stands for. And it brought me back to Renee Bracey Sherman, who is the director of We Testify organization. And she stated she stated that reproductive justice work is indeed anti-racist work and holds space in the Black Lives Matter movement. And so that's so powerful in knowing that we are transitioning in multiple components or becoming multifaceted in addressing the disparities that's before us. So thank you. All right, let's see. According to the Mama's Voice, for every 18 white women, there are 44 Black women who die from childbirth-related causes. And the CDC reports that Black mothers are dying 3 to 4 times the rate of their white counterparts. And, we look at that as a nation. If you read statistics, you'll see in different states that number can even be higher. Here in North Carolina, in New Jersey, I encourage you guys to take advantage, the audience, to do the research to support the work. But I also want to ask Tomeka, what story are these statistics telling us?
So basically for me, it's telling us that there's still racism in the healthcare system. Like, why on earth in the country that we live in are Black women 3 to 4 times more likely to die during childbirth than any other race? And, my story and it's regardless of socioeconomic status, pre-existing conditions, or any other thing. So when you take away everything else, all you have left is racism, right? So if you I'll use myself as an example. I immediately sought prenatal care when I got pregnant. They talk about education a lot for some reason. So I have a master's degree. I had Blue Cross Blue Shield. We talk about Medicaid versus, a private medical insurance. And I went to every single one of my appointments, did not miss one, followed every instruction I was told, and still ended up in the hospital for 45 days and losing our son. So when you take away all the factors that they say contribute to any type of maternal health crisis, there's only one thing left, and that's racism. And I think that's literally what the numbers are saying, that there's a lot of racism within our healthcare or maternal healthcare setting.
Tomeka, you brought up a very poignant point, and for those that may be watching media and all the things in articles and things that are posted in regards to maternal morbidity and mortality, it is a true conversation about the reasons for this disparity, and socioeconomic status often comes into play. But it reminds me of, I believe it's called Unnatural Causes, with Kamara Jones, who discusses that you can have the most affluent African-American woman during pregnancy do all the things right, go to prenatal visits, attend childbirth classes, have insurance and eat well and have all the things necessary. And there's still preterm labor, NICU babies, there's still losses. And so there's also in that, there is some information about the historical and systematic racism that occurs within the healthcare system, but also that our genetics and our DNA is built up with cortisone and stress hormones that affect pregnancy in African American women that does not show up in our white counterparts. So it brings to the point of talking a little bit about what is happening with Black women in the healthcare system. And Tomeka, I'll let you talk a little bit more about that, and then I'll discuss some more of the history.
So I think a lot of what's happening is we're not listened to. That's number one. So, and I personally didn't have that experience, but I talked to plenty of women who have. Like, you have to dress up to go to the doctor, which is ridiculous if you're 8 months pregnant and wearing yoga pants and working from home. So, I mean, it just doesn't make any sense. But I mean, there have been studies or people who have doctors who have said that they don't listen to Black women. And you can imagine being a Black woman in America, period. Like, you're already Black and then you're a woman. So you have two things that have already kind of like going against you walking in. And to not have your, like Amber Rose Isaac, most recently, I think it was last year before last, was in the doctor right when COVID started, and they weren't listening. She was having pains, and they weren't listening to her, and she ended up losing her life. Shalon Irving, medical professional, worked for the CDC, complained consistently after giving birth. They didn't listen to her. She also lost her life. Serena Williams had to fight for her own life while giving birth because she knew her body. And I think that that's one of the biggest issues. It's like when we go, and it stems back from years and years ago, where they think Black women have a higher tolerance for pain, so they don't believe us when we're complaining of pain. And then, we know our bodies, but they don't listen to us when we tell them. And it's a little bit of everything, but I think that's really a really big factor, is just not listening to the patients and not having patient-focused care.
Absolutely. And we know from history, that Black women have a jaded history with the medical profession, with healthcare systems. We think about Sarah Bartman and in the story of her, a ship surgeon actually turning her into a circus freak show phenomena based off of the shape of her body and the curves and her womanly phenomenal Blackness.
Right.
And then also, thinking about Dr. Jace Sims, who, had made really great efforts towards modern medicine, but did that at the exploitation and experimenting on enslaved Black women without anesthesia. And so it brings us to a place, one of the videos that in preparing for this, the ProPublica video on midwives, it states in that video that America is the most dangerous country to give birth. And that is such a harsh, yet a true and reality statement, especially for African American women. So, with the systematic healthcare system and racism and historical trauma, what do you guys think that can be done through, our government officials and leadership to ensure safety for Black women and families and infants when they go into facilities to give birth?
Is it okay? Can I jump in and say one more thing about the historical context?
Absolutely.
We talk about solutions. And everyone has touched on this, but I just want to name it explicitly. Like, ever since the enslavement of African people, the people in power do not want Black people to be able to control their own narrative and continue the practices that Black people have always established, even during enslavement, to take care of one another and just take care for our communities. Birth used to be a really, and in many ways still is, but a really sacred communal experience that was all about the mother and safety and the safety of the baby. And for weeks and months surrounding that unit with love and support and resources to ensure the best possible start for families. And that has always been something that white people in power, rich people have wanted to take away from Black people. I think that has always been the case. And I know I'm forgetting the decade, and if one of y'all know, please jump in. But there was a massive divestment from this communal practice of birth in the 1900s, when sort of birth became this medicalized and hospitalized experience, when it used to just be happening in our communities with community midwives. And birth was much safer when that was the case. And it sort of shifted to be this sterile, medicalized, dangerous experience that we now are seeing in hospitals. So I just wanted to name that explicitly, because we all had sort of touched on, this not being a new phenomenon. And if you look at the numbers, birth used to be much, much safer when we were doing it in the safety of our communities.
Maya, thank you for bringing that up, because then that takes us right into having this discussion of the Momnibus Act in 2021, Preventing Maternal Deaths Act in 2018, and then any future legislation that may come up. But the reality is that for those that are not familiar with the Momnibus Act, it really covers a lot of the details in the information that will address why the needs of African-American women are not being met, and takes us back and allows us that ability. Expansion of Medicaid, expansion of longer postpartum terms and care. Most of us don't see a doctor until we're, 6 weeks out postpartum. And then after that, it's kind of like back onto the wheel, and we don't see them again until we're pregnant again. So there are some really great details that have come through this legislature, and we're hoping that things will move forward, and it seems like it's slowly doing so. But also within that, using midwives and doulas have come to the forefront. And we know that there are statistics that show that doulas decrease, both midwives and doulas decrease cesarean birth, primary cesareans. They decrease medical interventions and procedures. They increase the security and the comfort of the family that's giving birth. And they do it within their own realm and their own scope, right? And so for this purpose, I do feel like it's important for those that may not be familiar that, doulas and midwives work together with physicians. They work together with nurses. They work together in hospitals. They work together in birthing centers. They work together in home births, right? And there are realms of safety for all of those facilities and settings. And so I think it's important for us to bring that to the forefront, that we are not trying to exclude any provider or exclude any caretaker or any advocate in support of safe birth for African-American women, but create an environment that's inclusive of all those that have the goal to allow for a woman to give birth the way she wants to give birth, where she wants to give birth, to create optimal environments and provision for optimal outcomes, which are healthy mom, healthy baby, regardless of color, regardless of ethnicity, regardless of culture. So I say to you, in coming to kind of the peak of this conversation, what's next? What action is next for the community person, the lay person? What action is next for our government officials and leaders in our community? What action is next for the hospital person that may be on the call and watching us? What's next? What do you guys see next? And I'll give it to Shavette, then Tomeka, and then Maya, if you'll go last to close it out.
Thank you, Genia. So I actually want to touch a little bit about, what can our government officials and leaders do, to become more involved in ensuring safety. So thinking about that and expanding more on the Momnibus Act, that is, composed of 12 bills that is able to help, to provide the resources necessary for us to achieve maternal health justice. So if we can, continue to encourage our legislators, continue to encourage our representatives, even our city council, we have to get really to it's a bureaucratic system in that sense that we have to start at the bottom and work our way up to make sure that these bills are passed, because at the end of the day, that is what is going to provide us with the resources that we need. There are several bills, that are in the making, I would say, or not in the making, but waiting to be passed. Only one has been passed so far, and that was for moms who have served. So we're looking at the veterans and providing maternal care coordination for them, and that is a start. And so the representatives who have begun this, which is U.S. Representatives Lauren Underwood, Alma Adams here in North Carolina, who's been doing amazing things, and then Senator Cory Booker, they introduced this. And so we have a long way to go before we can really start to see the changes. And that starts with these bills being passed. So that's something that our legislative, body can be doing, and also what we can be doing as well. So the next course of action, I would say, is to encourage, more education on this topic, more conversations on this topic. I think what the conversation that we're having is just the tip of the iceberg, and we need to continue having these conversations. I would say, March of Dimes has a great resource. It's marchofdimes.org/momnibus that shares more about what to say when you talk to your legislator, what to talk, what to write, when are their meetings, how can you talk to them in person if that's available. With the pandemic, things are changing, but definitely ways to make people comfortable with talking to legislators. I feel like summer of 2020 was a really big wave for a lot of us. And I'm talking about that racially. I'm also talking about that when it came to just justice for Black bodies in the US. And so during that time, I feel like a lot of people were able to lift their voices and to say, hey, we're not going to stand for this. Let's go ahead and talk to our legislative reps. And that's something that has probably been going on for a long time, but I feel like it came to the forefront. But I don't want that movement to die. And I don't want people to say, okay, we can do this. And then, okay, it's just social media, that we're going to share something and be gone. Like, we actually need to do the work on our behalf, on the people that we have lost, on the babies that are to be made, on, the opportunities that are here for women who haven't even thought about having a baby, for those who don't want to have one. We need to have these conversations, and we need to open up these doors. And to do that, it does start with having that advocacy of talking to legislation, seeing what we can do, and providing education on these important topics.
I agree with, excuse me, with Shavette. And yeah, I think officials need to make it a priority. I just really feel like bills take a long time, but it needs to be a priority. We're losing at least on approximately 800 women a year dying through childbirth, and that's too many for me. I mean, it may not seem like a big number to a lot of people, but for me, it's just too many. So I really think that legislation needs to be a priority for us. And yes, the Black maternal health, the Momnibus package is a lot of bills. They've actually put a lot of them into the Build Back Better Act. So passing that would actually fund a lot of the bills that are through the Momnibus Act. And it puts a lot of money in a lot of places where we need it. what everyone else can do. There are different organizations that actually, there's Mom Congress, which I'm a member of. We go to DC every May and talk to our legislators on site about these bills that affect moms. So there's different outlets there, but we also need to educate each other about what's going on. I think we should all know about disparities. No one should walk into pregnancy and not know, because when you know about things, you make better choices. And, you know, coming from my experience, had I known there was a maternal health crisis, more specifically a Black maternal health crisis, I would have had a doula. And my doula would have helped me get through my birth, and my son would be alive. And like Shavette said, it's not about taking doctors' patients away from them by any means whatsoever. It's really about having a community. And I think that's what we need to get back to, because I feel like that's what we're missing. A lot of people don't understand how much support they need when they're pregnant. It's way beyond anything you could ever imagine. I was in the hospital for 45 days. I didn't know how much support I needed then. I couldn't have imagined being in the hospital that long during COVID. So I have mad respect for anybody who had to give birth or lose a child during COVID, because that would have been the end of me if that had been the case. But I think as a community, we need to come together. We need to have those reproductive talks that you're talking about, because we've waited too late to start talking about babies. It's too far gone when you're pregnant to start talking about babies. You need to know that reproductive justice means that you have a choice. We need to make it okay to talk about not having babies, because that's okay. And it's not a taboo for you not to have a child. We need to have more of these conversations. That's why I respect Jamila so much for even, bringing this topic up, because it's not just about birth. It's also about non-birth, like having full autonomy over our decisions that we make for our bodies, and being able to do that safely, no matter what that is. So I think that's what we need to do. And I think that needs to be the next steps forward.
Yes, I absolutely second everything y'all have just said. In terms of legislation, absolutely. Medicaid expansion. Every single birthing person should have access to a doula if that is something they are interested in. And doulas should be compensated, because it's hard work. And if this country can fund the police and military in the ways that they do, they can fund doulas and medical health experts who are here to keep Black people and marginalized people safe. So those are really concrete pieces of legislation that I think need to be pushed forward. And then just to celebrate a win that we had last year with House Bill 608, the Dignity for Women Who Are Incarcerated Act, is a piece of example legislation that was passed last year in North Carolina that expands protections for pregnant, birthing, and postpartum birthing people who are incarcerated in jails and prisons. No one should, there's 50,000 things wrong with that even needed to be a piece of legislation, but absolutely no one should be handcuffed when they are in labor. So that was a win. And then I think, there's a lot of mutual aid funds that are really doing the work to meet the immediate needs of birthing people, whether it's diaper funds. A lot of doulas just volunteer because they care enough and have the time and resources to be able to do that. And so I think there's mutual aid funds, the Carolina Abortion Fund, since we're talking about, bodily autonomy. There's a lot of mutual aid funds that are doing the work to meet the direct need, which is great, but it's also not sustainable. And these are services that should be funded by the government, but the government has other priorities. So I just want to name sort of the role of mutual aid funds in this fight as well.
Absolutely. I think those are all very poignant and very accessible for people to do. And I want to bring up some comments have come in, and I want to talk a little bit about this. Our former Charlotte Mayor, Jennifer Roberts, is watching with us. And you know, back in 2016, she allowed for you know, paid family leave for new mothers. And, you know, she just something that simple to think about, that the time that's so precious that you can't get back as your child grows, as you're adjusting as a new you, not only to take care of someone, but becoming a new you as a family is vitally important. Suzanne Wertzman is watching, and I love this because she said, we need to invest in midwifery education at HBCUs. Well, you know, that ticked my box because I'm just going to shout it out. JCSU has a wonderful lactation program that I'm in connection with, program manager, visionary, as we push forward with Queen City Cocoa Beans. But you know, they have the doula program there. And so now it just makes sense to me. So I hope somebody at JCSU is watching, that they take that next step and create more Black midwives, more women of color as midwives, because we do see the numbers from midwifery care look drastically different from the norm of hospital or physician care. There's two different philosophies, although they both have the same goals. And I know many physicians who actually function and work similar to midwives. So I want to say that there are good physicians, you know, OBs out there. And we need the collaboration of those two providers to work best for us. You know, holistic care doesn't just mean the whole person, but it means the whole healthcare system as well, right? Because the more multifaceted the care is, the better the care is for the patient. I also want to just, I'm getting some things coming into the chat, you guys, as I'm reading and talking, you know, thinking about, and all three of you have said it, is thinking about, you know, how do we compensate doulas? Like, a lot of doulas come into the profession, and they come into the profession either throughout their own personal experience or their heart to serve. And so some of them come in broken, that need healing from helping others in through the experience. And some come in with being very strong and understanding and supportive of the most optimal experience possible for that birthing person, but don't have the connections to be able to survive and live off of this. So are we also saying that there needs to be more training? And I'm all about student experiences to address disparities, because I think that if we start to shift some of the professions from looking the way that they look and making them more diverse, then we can get a diverse best care practice and diverse evidence-based medicine, and there's no separation in that it looks different one from the other. All right, so I want to ask, is there any last comments from our panelists before we open up the discussion and see if our audience has any questions as they come through? We do have a little time for that, but I do want to get last remarks and comments from our panelists before we open it up.
Yes, so thank you so much. I definitely think that this has been an amazing conversation. I'm so grateful to be here with these wonderful, lovely ladies, just doing the work. And that's, I think, the thing that I want to highlight is how we are doing the work within our communities, and we are continuing to spread the knowledge, education, awareness, and resources to continue to uplift Black voices, Black bodies in the US. I want to talk about how midwifery is extremely important, and that there's a need for full practice midwifery, that they're able to have no limitations, and that they don't have to be contingent on having a doctor that supports their practice, but that they're able to really spread their wings and continue to do the great work that they do. I also want to highlight that the CDC has this program called Hear Her, and it's about Hear Her concerns. And it's at www.cdc.gov/hearher. And it's talking about how women aren't listened to. Tomeka touched on this a lot. And so they have guides, they have toolkits about how to start that conversation with your provider and what maternal health warning signs that you need to look out for. And also, I would encourage everybody, if you haven't already, to look into creating a reproductive life plan and what that looks like for you. It looks like that for anybody. And I'm not talking about just women. I'm not talking about just men. I'm talking about all people that have the ability to really discuss what they want. And even if you don't have the ability to physically birth, if you want to adopt, that's an option as well. So really having those conversations about what that looks like for you and creating a reproductive life plan. So thank you. That's my last sentiment.
Maya.
I'm not sure I have any additional comments at this moment. I think everything has been stated. I'm just excited to be here. Y'all are so wonderful.
I enjoyed you, so thank you. Tomeka?
Yeah, I love having these conversations. As you can tell by the way I always smile when we talk about this stuff, even though it's like hard conversations to have. I think they're necessary, and I think having good people, and that's the one thing about this space. There's so many amazing people working in this space and working for reproductive justice and for all birthing people. Is just amazing to see how loving and caring like all the people working in this space is. That's why I stay in the space, because I've met so many wonderful people. But I just want to I applaud all of you, because you're all doulas and I am not. So I want to thank you guys for, everything you do working in this space, because I just think that doulas are they're necessary. Like Maya said, every birthing person needs a doula and they deserve to have one. So let's just keep educating people and just keep working towards a goal of just like safe births in this country, because we pay more to give birth in this country than anybody else does in any other country. And we have the worst maternal mortality rate. And that makes no sense. So let's just keep working and keep getting this in these disparities as soon as we can. Thank you.
Absolutely. Thank you all for answering the questions and being so knowledgeable. Your expertise and insight has been extremely helpful. There are some questions and comments that have come in. I encourage you to jump in, feel free. I'm also going to jump in on some of these as well. One of the comments was, is it worth considering how we can connect more women to limited incomes to doulas? And I want to talk about some of the agencies that are right here in the Charlotte area. There's Rayo Community Health, who runs a doula program in collaboration with Johnson C. Smith and Novant Health. So if you're interested in becoming a doula, that's a way to connect. Also, they have a doula connection or match up, and they are also sponsoring families to have doulas. So I encourage you to reach out to them. Also at Johnson C. Smith is the lactation program that they also partner with DONA and Novant Health to do work, and Atrium is always connected. They have peer counseling groups and mental health programs and support groups. So I want to make sure that people know where to get connections. Something else has come in. Okay. Hi, my name is Destiny, and I am chartering president of Black Women in Medicine at UNC Charlotte. woo, woo, like you guys are like right around the corner. I'm like University area, Charlotte. What are things college students can actively be doing to educate and impact this area? I honestly, the preconception health program, peer counselor program is amazing. And I encourage you guys to do that, as well as there's community health training. We have nursing students that are doulas to support themselves until they get out of nursing school. Anybody else have ideas of what college students can do?
I think those are really good. I actually had the idea of actually going to colleges and sharing our story to talk about this as a forum. Because I think the conversation again needs to be had, and going from the space of preconception, that's a really good age to start talking about preconception and like what you want to do with your body for the rest of your life. And they're old enough, right? Like we always get into, oh, well, they're too young. You're really honestly never too young to learn about your body. But when we talk about birthing and having babies, we do want them to be of age and not to have any problems. But I think that's a perfect age group to actually have these conversations about reproductive. What do you call it, Shavette?
What do you mean? This reproductive health?
No, you have a term. A plan, reproductive.
Oh yeah, a reproductive life plan.
See, I told you you had something. So I think it's a perfect opportunity to start talking about your reproductive health plan. Or preferences, your reproductive health preferences. So I think that's one thing that they can do.
Well, to second everything that she said, I definitely think having that reproductive life plan is super important. Getting to peer health education. I was in peer health education in undergrad. I loved it. I did condom demos. I was drafting all the students to go get tested, really talking about your sexual health in addition to your reproductive health, because they coincide. So that's super important. I know that Maya and I definitely did the YWCA's just their doula program. They have a childbirth program. They have a teen mom mentoring program, teen families reading together program. So definitely get in touch with your YWCA, because you have so many resources here to touch your community. But definitely having those conversations and talking about what you want and your preferences is super important, because that makes the conversation normalized and you don't feel awkward about having conversations about sexual health or reproductive health. It becomes normal. And then people start having these conversations so these situations don't happen, because we're advocating for ourselves and we're providing those resources.
Yeah. And I just wanted to add two things. I know y'all are in Charlotte. I am based in Durham, and just wanted to shout out an organization called MAME, Mobilizing African American Mothers Through Empowerment. And we provide, I'm one of the doulas, but we provide doula services on a volunteer basis for primarily Black folks in the Durham area. So I wanted to shout that out. And then I also feel like college age and just youth in general, as y'all said, it's never too early even to just think about people who are capable of giving birth, like what assumptions are put on those people from such a young age. I wish I was one of those people that my first word was baby. I was going to be a mom. I knew that, but I never took the time to think about why that was something that was so ingrained in me from such a young age. And I wish even as a mom now, I wish I had thought more about, do I actually want to be a parent? What does that actually mean? Or is this just something that's been put on me as someone who grew up as a girl, and just the way gender works, and the narrative is really put on people from a young age is you should grow up and be a mom, and that is what matters, is reproduction. So I just think it's never too young to really think and sit deeply with sort of what you are talking about with this reproductive life plan, and really thinking critically about what you want for yourself versus what is society telling you should do with your life and your body.
I do have one more thing. I just wanted to shout out Wise Community Doulas that's in Charlotte. We work with them doing a community baby shower every year. They also, Fametta Darling is her nonprofit, and she's an amazing person and an amazing doula. And we work with her every year. We've provided scholarships for doula training there. And she also has a doula training specifically for people of color. And I just wanted to give her a really a shout out because she's so amazing and another big factor in this area.
Absolutely. I think we have, it's so awesome. In North Carolina, I think we have tons of resources. You know, Tomeka, when you started talking about Fometa and the baby shower, I quickly thought about Queen City Cocoa Beans. They do a baby shower and there's always something going on. So if you want to get involved, I highly encourage you to get engaged. Like, you just have to reach out to anyone. Someone knows. We're greatly connected. And I also, work very closely at Birth Compass with the doulas in Raleigh and in the Wake area. And so there is just so many wonderful things that if you want to be a part of something, if you want the training, it's there and it's available. And there are so many scholarships. I think about UNC Charlotte. I think it's Dr. Venus Stanford, who is training doulas and getting doulas trained to support families and being inclusive in that, because families look different. We know that, and we want to make sure that people are represented. And so we are right at 6, I think it's 6:55, 6:56. We do have a couple of other questions that have come through, and I'm going to quickly answer those and then hand it off to our CEO to close us out tonight. From our former Mayor Roberts, her question was, can the panelists address the challenges of environmental racism on mothers and birthing? Not many are aware of environmental factors that impact health outcomes, birth weights, chronic illnesses, and etc. And I will say, because of time, it's tight, but I will tell you that the resource sheet that Jamila Green has created, that you are going to receive after this is closed out, you will have a numerous amount of resources that will connect you to other resources. I often think about when you have a good resource sheet, it's kind of like an encyclopedia. You read it and then it tells you, now go look at that. And you just keep going deeper and deeper and deeper. And the deeper you dive, the more your passion will rise. And you will find there is a place for you. Black lives are literally at stake, and everyone has a part to play. Even if, and Tomeka, you were like, you're not a doula, but I'm here to tell you, you are a doula, right? Because speaking and giving a voice to your story, as well as being an advocate for others, that is the pure essence of being a doula, is being in support to save lives. And that is what you're doing with your story. And so don't ever discredit yourself as you're not a doula. Y'all know I can go there. But, doula are special people, midwives are special people, and not that anyone else isn't, but it just takes a certain heart and a certain type of passion and disposition and, a servant leader heart. Let's see, our last one is about Black babies and SIDS, more often lately. Does reproductive justice address that? Absolutely. Reproductive justice address that, because when you look at the entire story of a birthing person, and not just a birthing person, the entire story of a person, right? Because reproductive justice does not exclude males or those that identify as males, right? Because I don't want to do a whole childbirth lesson, but we know that it takes two to make it happen, or parts or components of one from the other. And so for those to both be healthy and come together creates a whole. So one whole and one whole creates a third whole. So I just want to make sure to put that out there. All right. Thank you guys so very much. We appreciate your time. We appreciate all of you who have joined us tonight. It always is right at the hour that it starts getting good and you start digging into the good stuff. but that just leaves work for you to for us to do. And so I encourage everyone, stay in touch. Everyone's name is on the image tonight, as well as you can read bios and connect with people. I'm quite sure everyone is open to being connected either on LinkedIn or reaching out. Everyone can be found. So if you need something from us, I am going to put it out there that we are all available to meet any needs. Whether it be you are a expectant family or person, or whether you are a person, that's my 7 o'clock alarm, you guys, whether you are a person saying, hey, I want to help and I just don't know where to, there's work to be done. And I promise you, I can find something for you to do in this realm of maternal health. And now I give it to our CEO.
I'm so thankful, Genia, for your moderation. I'm thankful for you, Shavette, and Maya and Tomeka for sharing personally and professionally what you're doing in this realm, which I think for so many of us, both people who identify as white and people of color, it's new information and we're learning it, and we're recognizing that the disparities aren't new, that they are deeply embedded. And, you know, I'm so grateful for you all being on this panel. And I appreciated earlier when Genia was talking about J. Marion Sims, the father of gynecology, and how he, you know, he was named the president of the American Medical Association, and all of his work had been done on enslaved women without their consent. These were things that I did not know as I began this journey. And it is so important that we know these things. As we look back through our own history with YWCA in Central Carolinas, the Charlotte area, where we will be celebrating our 120th anniversary next month in this region. One of our presidents on our board was Dr. Elizabeth Corky, who was very much involved on the eugenics board and in the eugenics movement. And for those who are not familiar, it very much disproportionately affected women of color and low-income women who were sterilized, oftentimes without their consent. So I know that this is, in some terms, for some people, new information, but I hope that when Jamila sends you follow-up information about the history of reproductive justice, and I think more honestly, the history of reproductive injustice, that you will take the time to learn more and to become more educated, because things are not black and white. There's a lot of gray in there. We'll be sending a list of information to our registrants to get you started on this journey. And again, we just thank Upstream for their support in our mission at the YWCA of eliminating racism and empowering women and promoting peace, justice, freedom, and dignity for all people. And we are grateful that they chose to do this sponsorship in the memory of Dr. Ophelia Garman Brown, a beloved member of our community who cared very much about, as Shavette said, having a reproductive life plan. Not an accident, but a life plan. And she was a true titan for change and a beloved member of our community. So on behalf of Dr. Ophelia Garman Brown and Upstream and all of your friends at the YWCA, thank you for being part of this conversation. Again, thank you, Genia, Shavette, Maya, and Tomeka, for an amazing conversation. Have a great night.
Thanks, everyone.